Egypt has confirmed its first case of a deadly coronavirus that emerged in central China at the end of last year and has since spread to more than 24 countries around the world. Health Ministry spokesman Khalid Mugahed said in a statement on Friday that the affected person was a foreigner, who did not show any serious symptoms.
Mugahed affirmed that all necessary measures have been taken in cooperation with WHO. The case was transferred by a self-sterilized ambulance to a hospital to be isolated and followed up, Mugahed said, adding that the infected person condition is completely stable.
Officially known as COVID-19, the virus was first detected in Wuhan, the capital of Hubei province in central China, in December last year. It has so far killed almost 1,400 people and infected nearly 65,000 others globally. 3 deaths have been recorded outside mainland China, 1 in Hong Kong, 1 in the Philippines and the most recent in Japan.
The case was transferred by a self-sterilized ambulance to a hospital to be isolated and followed up, Mugahed said, adding that the infected person condition is completely stable. Ministry has taken strict measures against those who were in direct contact with the infected person according to the statement. They were isolated in their locations of residence as a precautionary measure for a period of 14 days, the ministry stated.
There was an outcry in Egypt as doctors, nurses and medical staff had their annual leave cancelled. Authorities have deployed 10 self-sanitizing ambulances to deal with cases at a cost of 5.5 million Egyptian pounds, $348,514 each. There are 5 confirmed cases in the UAE. A coronavirus was first isolated in 1937 from an infectious bronchitis virus in birds that has the ability to seriously devastate poultry stocks. These viruses are responsible for between 15 and 30% of common colds. China has requested 145 million masks from Egypt as the death toll on the mainland reaches 490, reports the New Arab. Some 24,000 cases of the infection have been confirmed in the country. In China and across the world there has been a surging demand for face masks and a subsequent shortage as panic surrounds the outbreak. A World Health Organization-led joint mission with China will start its outbreak investigation work this weekend and will focus on how the new coronavirus is spreading and the severity of the disease, the WHO's director said on Friday. John stressed that Egypt was one of the first countries to develop a good preventive plan against coronavirus, as it was provided with an accurate detectors to discover any case infected with the new emerging virus. These viruses are responsible for between 15 and 30% of common colds. Over the last 70 years, scientists have found that coronaviruses can infect mice, rats, dogs, cats, turkeys, horses, pigs, and cattle. Most recently, authorities identified a coronavirus outbreak in China that has now reached other countries. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing. World Health Organization Egypt confirmed the news on its Twitter handle. WHO Egypt. It read as follows at WHO Egypt at WHO.